Hi, Ministers. Thank you for the information this evening. I just had two questions. The first is currently the cases of dorm residents that tested positive for COVID-19, 17 of them were recovered from a previous infection. Can I just clarify, based on this, I understand that the vaccination process currently going on in dormitories excludes recovered workers, or rather the vaccination is given to those who have not had a prior COVID infection. Given the recent cases, will this eligibility be reviewed? The second is on a possible third dose of the vaccine, of being vaccinated. I think it was mentioned just now that it may be a possibility that subsequent doses to guard against new variants and more regular doses might be required. Can we have maybe an idea if there's going to be a confirmation of a third dose in line with the current vaccination regime? Thank you.
I can answer the first point, Isabel. Indeed, for the recovered workers, we were planning to give them a single booster dose because studies have shown that there is a boosting of the immunity after you've given them a single shot. So we do have plans for that. I think that obviously the key thing is that we have also got to titrate the vaccine schedule according to the national vaccination schedule, because in terms of making sure that our Singapore citizens, our own population also gets vaccinated. So I think all that is under a big master plan, and we work very closely with MOH on that.
Indeed, as Minister has shared, when it comes to the migrant workers, we have been bringing them forward. We identify them as a group of people who do have an increased risk, not only of getting infected, but potentially of spreading infection as well. And it is in our interest and in their interest to make sure that they're adequately protected. However, within the worker population, we have been prioritizing those who are naive. In other words, they have not been infected before because their risk is the highest, well above those who have actually recovered from infection. And as we seek to prioritize them, we will also subsequently also bring those who have previously recovered from infection to come in also for further vaccinations. With regard to the third dose, this is something we've been studying, and other jurisdictions, other ministries of health in other countries have been looking at the same issue as well. At this point in time, there's quite a bit of thought that the vaccinations should be able to last us for at least 9 months, 12 months. We believe that it's going to be much longer than that, perhaps even 15 to 18 months. But beyond that, it's still a relatively uncertain situation. And there are two developments that may influence us in our thinking about giving further vaccinations, even to those who have received their first 2 vaccinations already. The first is, just as recovered workers may eventually have a gradually waning immune protection, this may also apply to those who have been vaccinated. And therefore, as we do tests following up some of these individuals who have been vaccinated, and we find that immune level starting to drift downwards, this would then be the right time to start planning to vaccinate these people as well. The other consideration are the viral variants of concern, where at this time, the vaccines that we've chosen, the Pfizer and Moderna vaccine, have shown still efficacy against these variants of concern, but we have to prepare for the possibility that there may be future variants that where the vaccines that we currently use are not as efficacious. And if that were the case, it may well be the case that we need booster vaccine doses to augment the immunity that we already have from the previous vaccinations and to give us additional protection, particularly against these variants of concern. So this is something we're studying very closely, and we discussed this with our counterparts in other countries. The manufacturers are looking into this as well, and they hope to produce improved versions of their vaccine that will have enhanced protection even against these emerging variants of concern. And where such a product is available, we may plan to make that available as booster doses in the population that had previously been vaccinated already.